of the most memorable patient experiences that I've had working at Psychovita and with HAE patients is a few years back, we got a phone call from a doctor's office. It was an urgent phone call that one of their patients was newly diagnosed with HAE and was currently in the ICU. Her airway was swelling. She'd been intubated. Very scary, very, 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 very out of the blue kind of thing happening with this patient. She was terrified. So we got the information we needed from the provider, called the patient immediately. She was, at this point, able to speak on the phone. I could tell she was very nervous, very scared, and we needed to get her medication. So I listened to her concerns, listened to what she needed, let her know what we needed on our side to be able to fulfill that medication request. She was able to take care of what she needed to do. We worked her case immediately. Everyone that was involved kind of dropped everything at that point. And this was our main goal, our main priority. And so as a team, we got all the pieces in place, got the information to the pharmacy. They were able to also reach her immediately, and she had medication in her possession within the next morning. It was probably, I don't know, 12, 16 hours from when we made that phone call to when she had the medication. And so that was a pretty big deal. And this patient, we still talk maybe weekly. We still talk. We have a really good relationship, and I just feel grateful to have met this person and be able to provide the support that they need in their life.
Indications and safety information. Indications. Sagizir, icatibant injection is indicated for the treatment of acute attacks of hereditary angioedema, HAE, in adults 18 years of age and older. Important safety information, warnings and precautions. Laryngeal attacks. Given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately, in addition to treatment with Sagizir. Adverse reactions. The most commonly reported adverse reactions were injection site reactions, which occurred in almost all patients, 97%, in clinical trials. Other common adverse reactions occurring in greater than 1% of patients included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, and rash. Post-marketing experience. The following adverse reactions have been identified during post-approval use of icatibant, urticaria, drug interactions, ACE inhibitors. Icatibant is a bradykinin B2 receptor antagonist, and thereby has the potential to have a pharmacodynamic interaction with ACE inhibitors where icatibant may attenuate the antihypertensive effect of ACE inhibitors. Clinical trials to date have excluded subjects taking ACE inhibitors. Use in specific populations, pregnancy. Available data from published literature and the pharmacovigilance database with icatibant use in pregnant women have not identified a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for icatibant and any potential adverse effects on the breastfed child from icatibant or from the underlying maternal condition. Pediatric use. Safety and effectiveness in pediatric patients below the age of 18 years have not been established. Geriatric use. Elderly patients are likely to have increased systemic exposure to icatibant injection compared to younger, 18 to 45 years, patients. No dose adjustment is recommended. For more detailed information, please refer to the full prescribing information at sagicir.com/pi. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-800-836-4380 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.